as you were looking at the whiteboard and you're looking at the vendors, what were some of the kind of the immediate changes that you saw, bottom line impact or,
Yeah.
improvements in, the healthcare situations that your employees were in?
We made incremental changes in every step. We ended up building a plan that had like 30 pieces. We changed our partners to be trustworthy. But the very first step we took was DPC. Now we happen to be big enough to be on site. That it doesn't have to be on site at all. It can be near site, right? So that was just what we did. There's advantages and disadvantages to that, but near site's just fine. But we did DPC. We invested $250,000. I served as the general contractor to minimize the construction costs. We had the CFO came to me and said, "We've gotten that $250,000 return. We didn't expect this. I thought we'd take one step, we'd measure 1 year later." It was in my head. Well, the first quarter closed. He comes back 5 months later smiling, "Matt, we just paid for that clinic and then some. Can you do some more of this?" So then we said, okay, well, physical therapy is like, I call it even DPT, direct physical therapy. We ended up putting a little room next to the primary clinic. This is the primary care of musculoskeletal. We can support people through that. We can prevent surgeries. And then we added on-site MRI. We could have, at the time, it was just this semi. But we realized if that semi was parked at the hospital plugged in there, that it was $5,000. But if it was parked at our building, it was $500. So then we said, we started looking at our health plan design. We realized that it was better for the plan, right? This year's claims are next year's premiums. It's better for the plan to spend 100% of $500 than 80% of $5,000. So the plan wins every time. And guess what? We can give it away to the patient. Imagine that. Free MRIs.